Good morning, America, and hello to the world. We're happy to connect with you every single day. We are from the International Fab Talks, connecting with various kinds of personalities with regard to their profession, their life, their views, and their thoughts. And today we are really honored to have the special presence of a wonderful guest. For the second time, Sir has graced our platform to share his expertise and to give us the right message and to empower us and to bring a beautiful balance in our thought process. Join us, friends, to welcome our celebrity and guest. He is none other than Dr. Ron O'Donnell, joining us all the way from Boston, USA. Hello, sir, and welcome to the session. Thank you so much for being a part of our journey. Thank you.
Good evening. Happy to be here. Thank you for inviting me, Crystal. I'm very pleased to talk to you again.
Thank you very much, sir, for obliging to be our guest for the second time. Thank you very much. I go ahead and share your profile and we begin the session, sir.
Okay.
Thank you, sir. Friends, it's a honor, a privilege, and a great responsibility to share the profiles of our celebrities and guests. And today we are honored to have the presence of Dr. Ron O'Donnell. He's here with us. He's completed his Ph.D. He is a clinical professor and psychologist at Arizona State University, College of Health Solutions, president of SunCrane Health Solutions, international consulting company, United States of America. I'd like to add more to Sir's profile. Friends, as I earlier mentioned, he is a clinical professor and a psychologist, and he focuses on bringing out the best in people, mainly focusing on healthcare. He is a leader in integrated healthcare, the coordinated treatment of medical and physical health using psychological interventions. That's really great to improve unhealthy physical health habits, you could call it, such as poor diet, lack of physical activities, smoking, etc., and mental health problems such as anxiety, depression. Sir focuses on that to bring about a change to empower the youth and empower the middle-aged and senior citizens as well. He leads projects not only in the US, across the world, in India, Bangladesh, Vietnam, Thailand, and China as well. He is committed to developing a new global workforce. Let me put that right. He is committed to developing a new global workforce of clinicians and community health workers to improve health. Sir is focused not only on the physical health, but also on the spiritual growth, the inner healing, and the psychological aspects of every individual. Let's get to know about how Sir has been able to do it all through these days. What are the challenges that he faces, and how he's able to collaborate and connect with people from other countries, and how is the response from people from other countries with regard to the various projects that our guest is associated with. Hello, sir, and welcome to the session. Thank you so much for being here. We'd like to know...
Thank you for the kind introduction. Thank you.
Thank you very much, sir. Thank you so much. We'd like to know now as to how you've entered into this field of healthcare connected to the physical and mental health as well.
Throughout my career, before I went to university, I worked as a director of mental health clinics. I worked for health plans doing population health, disease management, identifying people who had mental health and physical health problems and doing outreach to them. And I realized early on that our physical and mental health are connected. You cannot separate them. Traditionally, you go see your doctor, you get medical advice only. They might say, lose weight, stop smoking, but they don't tell you how. You might go to a mental health psychologist and see a psychologist or psychiatrist, and they talk about mental health, they don't talk about physical health. So I was interested in both. How do you promote physical and mental health holistically, a whole health approach? And that's driven my professional interest throughout my career.
That's excellent, sir. Holistic health, focusing on not only the physical, but also the mental health and the social growth of an individual. That's really nice. Now, sir, when you entered into this beautiful zone of connecting with people and not with machines, so that's really a great sacrifice on the part of your journey. I mean, on the part of your inner self to come and get connected with people, especially those suffering from various mental health disorders. That's really great. Now, sir, what has been the response of people around you when you entered into the zone? Were they all very accommodating? Did they accept you and your thought process that, yes, we accept him the way he is, and we give him a chance to go into the path which he has chosen? Because you have family members who stop us and say, no, it's mental health, then please don't go into that. I mean, it will take a toll on your health as well.
Well, we're trained as mental health professionals to keep separate our emotional reactions to the patients we treat. So that's part of our training, and with time, you get good at that. Of course, you feel empathy for people who are suffering, but you have to not suffer yourself, or else you can't help them. I do want to go back to your comment about people, connecting to people. And that's been critical for my success. I first began my career in academia as director of a doctoral degree program called Doctor of Behavioral Health, focused integrated healthcare. I had no plans to do any global work. I was working in Arizona State University and students from the United States. But I was introduced to a psychologist from Hong Kong who introduced me to his colleague in Beijing, and that began a passion of trying to promote integrated healthcare, not just in the United States, with my students, but globally. And to go back to your question, when I began in China, uh, people recognize the need for holistic health. They recognize physicians and nurses know just giving medication is not enough. They need to have more impact. Psychologists know that physical health is also important to mental health. So I found people very open to learning from me, to learning about these Western techniques. They had a real thirst for new knowledge. And in return, I'm also very humble, and I realize I must learn from them too. If I don't understand the China culture, healthcare system, people, holidays, diet, I won't be able to do effective consultation. So all my work is back to the people dimension. I love connecting with people personally to become colleagues and friends, to share hard work on projects and also lasting conversations over dinner. So to me, that's what makes the work so enjoyable. I can work hard, but also really enjoy the opportunity to meet people, first in China and now around the world, to promote my work.
That's really nice, sir. Thank you so much for sharing. What was the response of the Indian people when you connected with India? You connected with several countries and India as well. How has the response been?
But back to connecting with people, I've always enjoyed networking, meeting new people. So I met people from China. Then I went to a conferences in Taiwan, met people from all over Southeast Asia, and started making new colleagues and friends in Vietnam, Cambodia, Thailand. And over time, as I did networking, I met some colleagues in India, a University of Social Work called Cyber University, and they wanted to have my training for their social work students. I was happy to do that. So I've been doing that training almost for 2 years now with different cohorts of social work interns. We have the interns come into their program. I do a training while they're in the internship training on my topics on holistic health, and they're very open. They love to learn about these Western approaches to help improve mental health and physical health. And again, I've also learned about Indian culture. It's been many things that are new to me, and I realized, for example, that Ayurvedic medicine is also a holistic approach to health. So I needed to study Ayurvedic medicine as part of my work with India, understand the principles, understand examples. And now when I do work in India, I incorporate Ayurvedic medicine because it's already very popular. So that's an example of the joy I have, both bringing knowledge to different people in different countries, but also learning from them and adding to my knowledge.
That's really nice. You come across as a very humble person. That's really nice. To be connected with the right kind of people is a blessing. So,
It's a blessing, it's also a fun. It's enjoyable. Having
very,
friends is a big part of life, right?
very true, sir. That's really true. Now, sir, there are several people who suffer from childhood traumas, and when they grow up as adults, they are still being they are haunted with these thoughts or with those experiences as a flashback, as a nightmare. They suffer from childhood trauma. And if you ask them what's going on in your life, why are you not moving forward? They have this excuse, you could say, or maybe it's a real issue that they say, I've suffered terribly during my childhood. Now, how do I come out of it? Or either they keep accusing their parents, saying, because of my parents, I am unable to move on
Mhm.
in life or unable to maintain stable relationships as an adult. So it
Yeah,
has have yes,
there've
please.
been great advances in this area in the last decade. There's increased recognition. They use the label adverse childhood experiences, any kind of trauma. And it can range from, of course, severe trauma, sexual abuse, physical abuse, but even more moderate and mild trauma, having your parents being too busy because they're working to give you the proper attention. Not their parents' fault. They must work to make an income, right? So you must have empathy understanding this. But there's now a whole approach to assessing in adults their childhood trauma, to have questionnaires and interviews to learn about that. Because you're correct, people don't recognize their childhood experiences lead to their physical and mental health as adults. We know from research, if you have adverse childhood experiences as a young growing up child, you're likely to have worse mental health, depression, anxiety, post-traumatic stress syndrome, but also worse physical health, diabetes, hypertension, without knowing why. So unfortunately, there are many psychotherapy interventions now to help address childhood trauma, help people recover and find the resilience to move on from their childhood experiences to become healthy, fulfilled adults in their life.
Yes, sir. Thank you so much for sharing that. Thank you very much. Now, sir, there's a question like this. You are not free in a golden cage. You're much happier in a shack. How would you define this?
Well, I often refer to a global survey that's done every year by the Gallup organization. They measure across the world happiness. And what they find is oftentimes people are happy even though their financial situation, their income is not that great. And why is that? Maybe because of the culture, maybe because they're happy with their current network of friends, the work they do have. Of course, you must have income and not be in poverty to have happiness, but you don't need to be a rich person living in a mansion to be happy. And in fact, many people who are very wealthy are unhappy. So it's not to say being wealthy makes you unhappy or being having fewer resources makes you happy, but the point is happiness is determined by many things, not just money. It's determined by having friends, having family, having faith and spirituality. These are all things that determine an individual's happiness.
Yes, we appreciate that response from you. So now there are several people who have trust issues, like you being a psychologist. How would you help them address their trust issues? Time and again, they have been let down on the personal and professional front. So how should we deal with trust issues? Would you guide us, please?
Well, first of all, stigma about mental health and drug and alcohol, even some physical health, is very common. People are ashamed or embarrassed to think I am labeled as a person with depression, a person with anxiety, a person with obesity, a person with type 2 diabetes. These are things that people feel defensive about, understandably. So we need to be, as professionals, empathic and understand we're asking very personal questions. Ask permission first, show respect, explain and educate. People don't realize depression is very common. It doesn't mean that you're crazy. It means you have a lot of stress in your life, and that stress causes physical symptoms, emotional upset. When people understand better that mental health problems don't mean I need to go to an insane asylum, right? It means I need to work on ways to cope better with stress in my life. That's more understandable. I often use the word stress symptoms rather than saying you're depressed or you're anxious because we all recognize we have stress in our life, and that's less stigma. And last of all, we can train using techniques such as one called motivational interviewing that help to connect with patients and understand their values as a way to build trust.
Thank you, sir. Thank you. That's really nice. Thank you for sharing that. Now, Dr. Ron, I'd like to ask you, broken bones or a broken mind, or broken bones, broken minds, which one is easier to treat? I guess our guests and viewers would have the answers with them. We'd like to know your thoughts because you are connected with physical health as well as mental health. Now, where is the healing taking place faster?
Well, for any kind of medical or mental health condition, the complexity and severity determine that. So broken bones are relatively, if they're not severe, relatively easy to mend with physical interventions. Mental health problems, as you put it, broken minds, are determined by multiple factors, right? They're determined by genetics, by your social environment, by your peers, by your family, by your circumstances, by your income. So because they have more determinants than a broken bone, I hit my arm on a piece of wood and it fractured my arm. That's simple. The question is simple. If my problem is caused by things in my history, in my genes, in my environment, in my friendships, that's more complex and more difficult to address. So in general, mental health problems are more difficult to address than broken bones. But of course, there are also medical problems that are very complex, right? Doing brain surgery is not a simple procedure. So it's all relative But in general, for that comparison, mental health is more complex.
Yes, Dr. Raul, thank you for sharing that. Thank you very much. Now, sir, we have people who have a difficult choice to make. It's freedom or luxury. And we've seen many people jumping on the other side. The one who has a lot of freedom craves for luxury, and the one who has a lot of luxury craves for freedom. How would you define and explain this for us?
Well, of course, people want material things. That's only natural. In part, we do want to be successful in life and have things make our life more comfortable, whether it's a nice phone or a watch. So people that are resource poor, it's not bad to want to acquire things. On the other hand, it's also important to look for other things in life that lead to happiness, that lead to satisfaction, to lead to quality of life. And those are not things you buy. Those are, again, going back to having a sense of spirituality you're connected to, having friendships, loved ones who care about you, who you care about. I practice mindfulness, which is very much about sharing loving compassion and kindness with yourself and with others. So we know those kind of values improve happiness, whether you have income or not. And of course, people who have great wealth, in some cases, they get tied to very demanding work schedules, working 10, 15 hours a day, which takes away from their freedom, and they desire that. And that's also complex. Oftentimes, excess work is a sign of avoiding mental health issues such as closeness and family, other obligations. And so people who have great wealth often need help from professionals to better balance their drive to acquire wealth, which is not bad in itself, but the balance in life, to be able to focus on work and focus on my spouse, my children, my parents, my friends, my community, my temple, right? These are all things that make for a full life. Whether you're rich or poor, we need that balance.
Much appreciated, sir. Thank you very much for that lovely answer. Thank you so much. Dear sir, now I'd like to ask you this question with regard to the wars that are going on. Now, there are several people who are being targeted, the innocent ones, especially the children and the vulnerable. There's a great damaging impact on their thought process, on their mindsets. Now, have we been able to take care of that? It's not only the food, clothing and shelter that we give them as refugees matters the most. Even we have to be able to counsel them and give them that courage, or maybe the hope that the future will be bright for them. So we as psychologists, how far have we come in contributing to making those refugees feel better and accepted?
Well, unfortunately and realistically, in the midst of a war, during the actual war, it's not possible for psychologists to offer much help. People are trying to get enough food to survive every day. They're trying to get medical help for their sick children. There's no time or resource for psychotherapy. The needs are for food and water and medicine and physicians and nurses. So that's really a realistic answer. As a trauma and a war subsides and people are left with what you mentioned earlier, trauma from adult experiences or for the children, trauma from the war, there's a role for psychologists and other counselors to play, trying to help recover and find resilience, to make sense of what happened and to find a way to move forward in life without having constant senses of trauma, fear, resentment, anxiety. It's very challenging, and I don't want to make an easy answer. There are many evidence-based psychological approaches to help people that have been through war. But again, in the middle of a war, when things are hot, right, when the war is active, there's not much you can do other than provide the support people need to survive day by day and the safety.
Yes, sir. A wonderful, a response. You've given a wonderful response. Like you've not taken anything into like you've been very thoughtful, very careful while giving that answer. Thank you very much for sharing your thoughts on that. Now, sir, domestic violence is one of the major problems in the world across all cultures, across all caste, religion, and geographical locations. Now, how does one deal with domestic violence? How much is too much for either of the spouses? Let's not be biased over here saying that women suffer more in a family setup. It could also be a male member too, the father or the husband. Now, when I would like the question here is when is it time for us to understand that it's too much now? No, I can't take it more than this. This is the limit.
Well, you're correct. First of all, while domestic violence affects all genders and all types of expression of gender, women are disproportionately affected. They're more likely to be abused by their partner. And what to do, again, there's no one answer because it's a complex problem, but it requires a complex solution. Certainly for women who are experiencing domestic abuse, having access to some kind of counseling by the many organizations of women who help women who are being abused, advice where to get help, resources, what to do. That's one approach, but also you need broader approaches that include social and government reform, right? Making sure that the authorities treat domestic violence seriously and take it as a problem that needs to be improved and hold people accountable. And as you know better than I do, we're a long way from that being the case globally. In many countries, including India, there's often no accountability, and it creates a really unfair situation. And all we can do is encourage the women, mostly who are really rallying to help reform government and offer services to women who have been abused, to applaud them, continue to support them, whether it's financially, volunteering, do things we can to help support the great effort against many barriers to improve domestic violence in India and globally.
Yes, thank you so much for sharing that response. Thank you very much. So now there are several students who have crossed the borders of their own country and they have embarked on a new journey to visit a foreign land, either for studies or for a job. But once they are on foreign shores or foreign sands, they become depressed. And many of them have attempted suicide. Some have gone into severe depression for months on end. So what have the governments of various countries who draw a lot of students into their land for studies or for jobs, what measures have the government taken, to help these children to overcome the challenges of they missing their family members and adjusting to the new culture? It really takes a lot of, toll on these children, especially who cross, and go to other countries. We've seen several cases where children are unable to cope with it, and many of them drown themselves in drugs, alcohol, smoking, etc.
Yeah, so the most common scenario is a student who goes abroad to study, like a university or a trade, and they go to a different country. And that's very stressful. It's stressful to go to a different country, different culture, experience many new things to learn, not just language, but the cultural norms and rules, how to navigate society. They often go there with all their best friends left behind and no current friendships. So for those students, whether it's high school, university, graduate, luckily most schools, especially universities, do offer programs to identify these students, to offer counseling in university to help them, all kinds of organizations. Maybe you might go to Thailand or United States and find an Indian social organization to join, to meet other people from your background and countries. You can connect people of your own culture, not to exclude yourself from the new country, but to have one source of support and anchor yourself as you try to incorporate and learn the values and norms of the new country. So there are services available. There's never enough, of course, but there are people who recognize this problem, who have very good programs. And some of the best ways to address this are just individual therapy, explaining the challenges, the stress of moving to a new culture, ways to cope with that transition, support groups, people they can find to connect to, whether it's both local people from a new country, new friends from new countries, and friends from their own country for that anchor. That combination can be effective for that very common problem.
Yes, thank you, sir, for sharing that with us. Thank you very much. Now, sir, I'd like to go on and ask you with, this issue concerned with, the family system, where the family system, where the parents are divided or separated, and the child in the middle suffers. He loves both the parents, he or she, the child loves both the parents equally. Now, the child is unable to decide, should I be on my father's side or mother's side? The child is torn or sandwiched between both the parents. Now, what would you like to suggest to such parents who are the cause for the pain of their little children?
Well, there's a great deal of research and writing on how to help parents who are either never married in the first place or have become separated or divorced to still do the best they can as parents in spite of their separation. And of course, the more there's animosity between the parents, the more difficult that is. So there are both couples counseling techniques to help reduce animosity, understand each other's perspective more effectively, and as importantly, or more importantly, how to be effective parents even though you're living apart, and make sure you're unified in how you approach your child as parents even though you're living apart. So there are many good couples therapists and counselors who can help individuals with this. It's always nice if both of the parents are involved in counseling. That's not always possible. Sometimes one parent will decline. Even a single parent can do things to help improve things without their ex-partner being involved. So again, there's encouraging news. There are approaches and resources that have proven effective. And like all these problems, there's not enough couples counselors to go around to meet the great demand for this kind of problem.
Thank you, sir. Thank you for sharing that. That's really nice. Now, sir, I'd like to ask you, if somebody would like to be in your shoes, they would like to be the next Dr. Ron O'Donnell, what hard work and what are the various things they have to go through to be where you are?
Well, there are many, books on keys to success, and certainly one is having a vision and a passion for something you want to accomplish. So if my vision is to help improve the lives of people globally, to improve the physical and mental health, that's a big goal. So I have that as my vision, but then I find ways to take small steps to achieve that vision, whether it's working in Vietnam with the World Health Organization now to develop standards for psychologists to do psychotherapy, whether it's working with India social work students to train them. I find small steps that are concrete to help me begin working towards achieving that vision. And it takes, of course, a passion and love for what you're doing. It also takes hard work. I'm constantly reading new articles and new research on what's emerging as best practice for all these problems. I'm routinely consulting with colleagues, asking them for advice. What are they doing for this problem in their country so I can learn? So it requires a deep curiosity, a passion for and a love for what you're doing, and a curiosity to constantly improve yourself. You can never assume you know everything and you're ready to become a leader. You must always refresh your knowledge, both academically with readings and books, but also culturally and socially by having good colleagues you can learn from and teach you things you aren't aware of in different cultures.
Yes. Thank you, sir. Thank you for sharing that. Now, sir, would you suggest for us, like the people who would love to come into this beautiful field of serving people, both on the physical as well as the mental aspects, where you are connected with, what is the best certification they can take up, like the best certification, to put that right? Like you're connected with social work as well and with mental health and all of that. So the best and the simplest certification, which is not very costly, which is affordable for the middle class or maybe the lower middle class as well, because they would love to also contribute in a right way.
Well, of course, I'm glad you mentioned about affordability because there are many pathways to be a healthcare professional, whether it's physician, nurse, psychologist, social worker. There's no one that's necessarily better. Some require more resources, more money, more time. Those are all pathways for those who are middle to upper class. And the good news is for those who are not upper class or have the wealth, you can also become just a lay counselor, a community health worker, or there are often people globally who are retired individuals who want to still contribute to their society and their community, who are trained by nurses, by social workers, by psychologists to become local health workers in their village. And they can then educate their peers, offer resources. They can be trained to help with how to manage diabetes, how to manage hypertension, how to manage depression. One of my good colleagues in Vietnam has trained thousands of community health workers, people with no clinical degree, to work on treating depression. So the good news is anybody who has an interest in time can contribute, whether it's through a formal degree or through just volunteering and helping with local organizations. So I think the answer is there's no one best. What's best often varies by country. So if you mean best, what's the least expensive route? to have a position to help people and also have a good income, in USA, that's probably social work, because a social worker can complete their bachelor's degree, 2 years of education plus some internship training, and they can make almost the same amount of salary as a psychologist. It requires much more education, maybe 5, 6, 7 years beyond their bachelor degree. So social work is often a good profession because they're available. They have good education foundation, but it's not the only answer. It's one answer to a complex question. If you have a passion, try and find a pathway that fits your background, your personality, and your income and resources. If you can't afford to go to medical school, most of us can't, try and find other ways you can contribute to local volunteer organizations.
Yes, sir. Thank you, sir, for sharing that. Much appreciated. Now, sir, one major problem that disturbs the entire situation at home or maybe in a public space is alcoholism and drugs as well. Now, this is very rampant in most parts of the world, right under the nose of the government and the officials, police officials, or you could say the various officials that are there. It happens right in front of our eyes and we're unable to do anything about it. Now, how can we tackle this with proper counseling? Does counseling work for such people?
Oh, it definitely works. We have many approaches for alcohol and drug counseling that are proven effective. Some are very brief. We know sometimes just very brief interventions, a good talk and a referral can help people. So for example, they've had in Europe and China an approach called very brief advice for tobacco smoking, where you simply, in the course of 45 to 90 seconds, do a screening. Oh, I see you're smoking. Give advice. Here's the problems and consequences of smoking. Show examples, maybe show examples of people that are suffering from lung cancer, oral cancer, and offer a referral. You can go to this hotline and call and get information about smoking. That's proven very effective. Does it help everybody? No, but it helps many people can improve even that brief intervention. And of course, there are other interventions that are more resource intensive, but also more effective for more severe problems, whether it's a smoking cessation nicotine replacement program. And for alcohol, it's no different. There are many counseling approaches such as motivational interviewing, cognitive behavioral therapy that have been evidence-based and proven effective. We just need more professionals, counselors, psychologists, social workers, community health workers who are trained in these techniques. And my current training includes motivational interviewing and brief interventions for alcohol because they're such common problems. So the training is out there, just a greater need for more resources. You also have to recognize that people with alcohol and drug problems, they're blamed for the problem. It's a moral character weakness. And we know in most cases, alcohol and drug problems are caused by stress. People are having all kinds of stress in their life, whether it's family, financial, work, education. And when you're feeling stressed, when you're feeling anxious, worried, depressed, you want relief. You want to avoid those feelings. And taking a glass of alcohol is a great way to avoid those feelings. In the short term, it's effective. I have a glass of alcohol, I feel better. In the long term, if I have 2, 3, 4, or 5 glasses, begin having blackouts, being hungover, missing work, it begins to not to be effective, right? So it becomes harmful drinking. So you have to find ways to help people understand the stress in their life and find ways to cope with that stress. You can't just say stop drinking without adding something to replace drinking as a way of coping with stress. So it can be relaxation, mindfulness, cognitive behavioral therapy, exercise. There are many things we can do to replace alcohol as a coping tool. It's not easy, but it's possible, and evidence shows it can be done as long as the person is motivated and wants to get some help for their problem.
Yes, sir. Thank you, sir, for sharing that. Thank you very much. Now, sir, which country has been very, very accommodative with regard to welcoming you and your thought process and the work you are into? You've been connected with several countries. Now, which country was more accommodating and welcoming?
Oh, they're all equally accommodating. And by that, I mean, I receive a wonderful welcome wherever I go, whether it's physicians, nurses, psychologists, greeting me with great thanks, with maybe some media recognition, making a short story in the paper about the story, maybe having local performers and dancers perform, or musicians, wonderful meals. So I find every country I've been to, I can name them all right now, I've been well received and treated very well. And I'm very grateful, and I really express how grateful I am and try and do the best I can in return to offer all I can, both being gracious and uh, a good participant in their healthcare system to learn from them also. So it's a win-win situation. When you receive good care, you want to return the compliment and give good care back to others.
That's really nice to know, sir. I'm really happy to know about it. The way you shared that with so much of love in your eyes and, gratitude in your heart, that's really nice. Now, sir, one major question, and before we sum up, like we find the youngsters entering into their first relationship and then having a breakup. There are several youngsters who have this in mind. The first person I meet in my life is going to be the person till I breathe my last. And this is not very true in most of the cases. So there are several heartbreaks in the middle, or the very first heartbreak they face, they go deep down into depression, irrespective of gender. Now, I want you to give a word of caution or some suggestion for such individuals, especially the youngsters, how to keep their hearts safe and their minds sound if there is a breakup.
Well, I think that's been a problem since the start of mankind, right? The heartbreak of breakup is always very difficult. And the vast majority of individuals, women and boys and girls who go through this, have a normal period of grief and sadness and recover and move on to find the next partner, right? And they learn from experience. The first time is always the more difficult, right? Most difficult, perhaps. And again, having for most people, simply friends and family supporting them, offering empathy, support is all that's needed. And if it's more complicated meaning the person already has underlying depression, already has depression with suicide, they're at greater risk and they require more professional care. That's a small percentage of all those who suffer breakup and heartbreak, but we have to be aware that what's the line between normal grief over breakup and sadness and something that's more concerning and severe, like a depression with a suicidal ideation, or alcohol abuse for younger people, or drug use as a way of coping. Again, goes back to the impact of stress. So breakup is stressful. We have to build resilience and coping in youth to be able to handle these kind of problems.
Yes, much appreciated, sir. Thank you very much for that. Thank you so much. Now, so one last question before we sum up the session. Could I take another 5 minutes from you, please?
Yes, you may.
Thank you, sir. Thank you so much for being so polite and humble. Thank you very much, and for being very flexible as well. So now there's something called as assumption. We don't know the actual truth. And there are several people, including me and many of the people out there, who have this assumption that you take for granted, or maybe this so and so is the situation, but it's something completely the opposite. We think in one way, we assume things in one way, but the truth is something else. And there's another concept also called like expectations. When we have a lot of expectations from people, we are again going down in life, or maybe we lose out on many things. So assumptions and expectations, if you could share your thoughts on that, how we should stay safe with these two heavy terms.
Well, I think it's very clear from research and just our own experience, how we interpret the world determines our happiness and our being content. And many people experience events and interpret them negatively. Others just the opposite. Am I a pessimistic person or an optimistic person? One student gets a grade of a C and they were worried about failing, they're happy. This other person gets a grade of a C on an exam, they wanted an A, they're unhappy. So the same exact experience can lead to different reactions. That's very common. And again, luckily, there are many counseling approaches designed to address that error in how we interpret our world around us. We make mistakes and don't know it. So, cognitive behavioral therapy, a key foundation is we learn to become aware of our thoughts, especially negative thoughts, and we challenge them and test them. If they aren't accurate, what's the more accurate interpretation? If people that misinterpret their world and are more negative, they can learn to become more accurate and then interpret it more accurately and often in a more positive way. And they then have less anxiety and depression. We know from mindfulness meditation that's being taught that if you learn to become aware of your thoughts with acceptance, with curiosity, without judging them, you can then see more clearly where you're making errors in your interpretation of events. So There are many good ways to do this, but again, it's a big challenge. We have all kinds of things in our environment that continues to support having poor expectations and misinterpreting things. We have social media, right? You have many groups that want to ferment hatred and anger that becomes very stimulating. People get a good feeling from that, unfortunately. So teach people how to use social media properly to avoid being sucked into unnecessary anger, grief, upsets. It's a complicated problem, and there are luckily people aware of these problems and trying to find solutions for them. Just as two examples, cognitive behavioral therapy and mindfulness are both commonly used to address that problem in our thinking.
Thank you, sir, for that. Thank you very much. Much appreciated. Now, sir, we'd like you to give us a message. What is the message you have today for us?
My message is that, we live in a world that's increasingly experiencing unhappiness, depression, anxiety, alcohol and drug problems, financial problems, global conflict, increased air pollution, increased global warming, many reasons to be unhappy. And my recommendation is that individuals, we find ways to build our own resilience, to make ourselves the best we can in our situation, to cope the best we can, to learn how to cope with stress more effectively. And we also try to, as individuals, contribute more broadly to improving society, whether it's through politics, social support organizations, volunteer organizations. Become active in your community, finding a purpose to help change things that you think are part of why you're unhappy in the first place, whether it's influencing politicians to address pollution, whether it's trying to contribute to campaigns for peace, offering help for those who are in wars or suffering domestic violence. There are all kinds of ways we can contribute. So my answer is to find ways to help yourself become stronger. Then as you find that strength, share that strength with others by volunteering and having an impact beyond your own self and beyond your own family, but to help your community.
Thank you, Dr. Ron. Thank you very much. You've been very kind to share your time with us and share your expertise and knowledge. And you've given us a wonderful message towards the end. We look forward to many more interactions with you in the near future as well. And we would love people to be, taking a lot of inspiration from you. You're a wonderful inspiration to us. You're a role model. And we wish all our audience and guests and the viewers out there to be focused on your journey and to take the best thing that you've ever got in your life from this beautiful session. We had Sir sharing his thoughts and views on various important topics which were discussed. Thank you very much, sir, for being here with us. Stay blessed and stay connected, sir.
Well, thank you for your wonderful questions. I always enjoy your questions. They're always thought-provoking. There's no preparation, by the way, for the audience. These are all new questions from me, and I really enjoyed the challenge of the questions you raised. They're very thought-provoking, and happy to share whatever I can to help. And as always, I know you'll post my email address. If you want to talk to me after this, if you watch this video for any brief advice or collaboration, I'm always happy to meet new colleagues and share at least a few moments to talk either by text or on video and share knowledge and ideas and work together to try and improve our world holistically as friends and colleagues. So thanks for that opportunity.
Thank you, sir. Thank you very much, sir. Thank you so much. My dear friends, thank you for watching this episode. We really wish you all the best. And we want you to be the best version of yourselves. And that is why we bring here wonderful celebrities and guests who have expert knowledge in their domain, be it mental health, physical health, and just anything. We want the best for you. We want the best for ourselves as well. With this, we'd like to sign off from the International Fab Talk for today. Thank you. Thank you, sir. My dear friends, with this, we'd like to sign off from the International Fab Talks for now. If you like what the International Fab Talk team is doing, connecting with the right kind of people, bringing in experts to share their knowledge on various aspects of life and profession, do like, share, subscribe, and comment to the International Fab Talks. And above all, love yourself, love your family, protect the environment, and stay blessed.